Hello, I am Sarah McLean. I'm one of the editors-in-chief of Health Sociology Review, and today I am interviewing Professor Kevin Dew from Victoria University of Wellington about his new paper that appears in Health Sociology Review called Ascertaining Patients' Understandings of Their Condition, a Conversation Analysis of Contradictory Norms in Cancer Specialist Consultations. Did I get that right, Kevin?
Yes, you did.
Brilliant, brilliant. Okay, thank you very much for speaking with me today. How did you come up with the initial idea for the research?
Well, this paper is based on some research that was over a number of phases. The original research was looking at trying to understand what the health services or the health system contributed to cancer inequalities. And this phase of the research was looking at consultations between health practitioners, mainly medical oncologists or radiation oncologists and others, and patients. And the idea was to try to get at those consultations when a treatment plan was being decided. So the patients had already known about the diagnosis in most cases. There was one exception. And then, so we were trying to understand if there was anything we could see there that was of interest in relation to initially inequalities. But for this paper, we got interested in some other aspects of what was going on. So we sort of shifted, but just because of our observing of what was happening, we decided to have a look at how questions were asked by the practitioners and what implications that had. So that's kind of where we ended up going.
Oh, fantastic. So I think you've kind of anticipated my next question, which is how did you make the decision as to what methods to use in the paper?
Yeah, well, because we had interactional data, we thought of possibly using conversational analysis because that's an approach you can use when you've got interactional data. It's very resource intensive, but so what we initially did was we transcribed all the consultations in generic or orthographic transcription. And then we sort of read through the material, and then as we were looking and observing, things came up and we thought, well, this deserved a more detailed look. And so the detailed look was conversational analysis allowed us to go in with that more detailed look. So we chose to use conversational analysis.
Fantastic. So what were the main things that you found?
Well, in terms of the original looking through the data, we did start to notice that there seemed to be something interesting about patients responding to questions that seemed to be asking them what they understood about their condition. So we gathered a collection of what we called ascertainings, hence the title, ascertainings, patient understandings, and then started looking at that quite closely and seeing that there were quite different outcomes for patients in terms of how the question was asked. So so we ended up with sort of three categories really. If a health professional asked the patient what they understood about their cancer, they would almost always get a minimal kind of response, or the patient would sort of change the question. But if the health practitioner asked them what someone else had told them about their cancer, then they would give a much more fulsome kind of response. And if the health practitioner asked them what their experience was, like, when did you first notice it, or that kind of experiential stuff, then they also got a very fulsome kind of a response. So, and what tended to happen with those, so those fulsome responses meant that the health practitioners had much more to go on. And if they got those very minimal responses, then the health practitioners had to work quite hard in order to work out how to, in a sense, scaffold their consultation.
So what do you think is the main contribution of the paper?
Well, by sort of identifying those three different kind of responses to those questions, we were able to think about why is that? And we started to think about the kind of norms that were at play in the consultation. And so one of the contributions is that being aware of these norms can actually facilitate these consultations. So one of the norms or contradictions between norms that we noticed, for example, was between if you're asking a patient about their understanding, that will be taken as a test of their knowledge. So then they can have a problem of, on the one hand, wanting to be seen as a competent person, a competent patient, but on the other hand, not to be telling an expert something that the expert's supposed to know. So it was this sort of contradiction of these norms that was at play that we thought was important to be aware of to facilitate these consultations in incredibly stressful circumstances.
Yeah. So what do you think are the implications for specialist consultations with people with cancer?
Yeah. Well, I think there's kind of two really. One is just the implications for clinical practice. Very simply, that don't phrase your questions in ways that are seen as tests of knowledge. I mean, these are cancer consultations, so they're not the same as a GP consultation, but in these kinds of consultations. So, and there are really simple ways of phrasing them that mean that patients don't receive it that way. So that was like a really important, simple kind of a message. The second message is really, again, just exploring this idea. We have ideas in health about patient empowerment and shared decision making. This is sort of reinforcing the idea that there are asymmetries at play here between the patient and the health professional. We're never going to overcome those asymmetries, but we can deal with them in certain ways that mean that to make it more open for patients to sort of be engaged in the consultation. Even though the asymmetry is always going to be there, you can foster that consultation, that engagement in the consultation.
Fantastic. Well, thank you very, very much for that, Kevin. It's really terrific to hear your explication of the research and the implications that it can have for clinical practice, and I'm sure more broadly as well. Thanks so much.
Okay.